Welcome, everybody. It is the Monday edition. Well, it's the only edition this week of Health Talk. It's on Monday, every Monday at 8:30. So, good morning, John King.
Good morning, Peter. Keep wishing for that week when we have 2 Mondays. It's going to come, and you'll be happy, I'm sure.
John, among our listeners knows that Monday is always my favorite day of the week. And I like Mondays because all that nasty, unstructured weekend time is over. You're back to work. You got the schedules. You got your product. You're being productive. All sorts of good things are happening. And these women are staring at me like I'm out of my mind.
Everybody is.
But it's part of my shtick. What can I do? Anyway, welcome to Health Talk, everybody. I am Peter Christian. That's John King. And Susan Rick is joining us this morning, and we are very privileged to have you here, Susan. First of all, welcome.
Thank you.
All right. Tell us, now you are the director of the Cancer Services Center, Community Medical Center, and that's got to be a huge job. So tell us a little bit about your position and how you came to community.
I'll start with how I came to community. I had traveled quite a bit with different assignments being in the military. I traveled to Germany and then came back to Minnesota, and from there it came out to Montana.
What branch were you with?
My ex-husband was actually with the Air Force.
Okay. All right. And so you traveled all over the world and you came back here. What brought you to Missoula?
You know, we had traveled out here for our honeymoon, and we had our honeymoon at Glacier, and we absolutely loved it and always wanted to come back. And they were advertising for an educator at the Heart Center then, and it was just opening. It was in its infancy. And so I came out and had an interview, and they hired me while I was here, and I guess the rest is history. I went back and gave a 2-week notice and came back to Missoula.
So you've been here how long then?
15 years.
Wow.
Wow. Yeah.
This is the longest I've lived anywhere since I was in high school, so this is home now.
There you go.
So you kind of have your thumb on the picture of cancer in the state of Montana. I assume with a name like Cancer Center, you look at this at a pretty broad view, right?
Correct.
So what does it look like in Montana? Do we have a high incidence of cancer in the state?
You know, every year there are about 5,600 people that are diagnosed with cancer in Montana. And I think all of us know somebody or our family members that have been diagnosed, and so we're all really touched by that. Unfortunately, we have about 1,900 people that die in Montana every year, but the good news is that there are 53,000 survivors currently in Montana.
Wow. One of the things I do every year, and it's an honor for me to do it, is I don't make a big deal out of it. It's because it's important to me. For the Relay for Life, about 7 or 8 years ago, they asked me if I would come and read the names for the luminaria. And I said, okay, I didn't quite know what to expect, because I didn't really realize what the luminaria was. Mm-hmm. And the fact that what people do is they have these paper sacks and they put candles in them. And then they will decorate the sack with the name of a survivor or someone who wasn't a survivor or a friend or relative or dog or a cat or a grandma. Yeah, almost anything.
Frank Zappa. Always gets a.
Exactly.
I always see a bag for Frank Zappa.
Exactly. And what I do is I slip in my mother and father, who both died of cancer. And so it is an honor for me. I know John's done it, and so many others in the media world have done that. And it's our little way of giving back a little bit to, using the talents that we have to help out. Mm-hmm. So tell me what it means for you working in the Cancer Center to talk with and deal with these folks who are, A, going through this experience, and B, who have come through the other side.
Really, it's just an honor to be involved in people's lives during that. It's a very difficult time for both the families and the people that are going through that. And I think all of us at the Cancer Center really feel like we are privileged, and we're so glad that they choose us to provide their care. I think that probably the biggest compliment that you can ever have is when people are finished with their cancer treatment, and because they've developed such close relationships with us, they come back and they visit. And I can't imagine going back to my dentist's office and going back to visit because it was such a great experience, but they come back and they are so pleased, and they actually miss the people in the Cancer Center and coming in. It's become a very close-knit family while they've been there, and I think that they feel that each and every time that they come in.
Wow. No. For those of us, I have family members. My grandmother died. My sister-in-law went through a very intense cancer. We just lost one of my friends. They got married at the same time, had kids that are the same age, and she passed away from an advanced form of cancer that went into her bones. There's all kinds of different cancers out there. But some of them seem like they're a death sentence, and some of them nowadays seem like we can handle them pretty easily. And I guess my question for you is, when we talk about cancer in Montana, what seems to be the biggest threat?
Tobacco is really the biggest threat in Montana, both chewing tobacco and smoking. And that's probably the biggest factor. Not only does it have effects on lung cancer, which is what you really think about when you think about smoking, but smoking and chewing tobacco also causes cancers of the mouth, the neck, the esophagus. It also plays a role in cervical cancer, colon cancer. So it's really the biggest threat to people in Montana is smoking.
Wow.
And chewing tobacco.
Still, but has that gone down over the last 2 decades?
The incidence of cancers associated
Tobacco
with tobacco
use in Montana in general?
Not really. It hasn't gone down a whole lot.
Really?
So we're wanting to see more.
Even after all the public education and the media blitzes and campaigns and stop smoking and your kids bugging you not to smoke, but it's still up there.
It's absolutely a problem in Montana.
Huh.
I tell you what. Would you please, and I'm the everyman here, I'm the one that asks the really dumb questions. So for those who don't know, we hear about cancer all the time, but I bet a lot of folks don't really know exactly is there a definition of cancer? What is it, or is it just a huge area of study?
Well, it's just really an abnormal growth of cells. That's what cancer is.
Okay.
And so it can happen in any part of the body, but it's really when those signals turn off the cells that typically would tell them to stop growing, and those somehow get mixed up in the DNA, and they just don't stop growing, and then they become a problem.
So anyone could have cancer at any time if their cells just decide to stop telling their cells to shut up and stop growing, right?
Yes.
So go ahead.
Heredity always plays an incident or a factor in that, and there are different kinds of cancer that are definitely hereditary in nature. Breast cancer being one of those, and I think we all know about moms that have daughters and families that have aunts and uncles that have prostate cancer. That's also a link there, and you see those familial kinds of things through the hereditary factor. But we also see those that are sporadic, and they have absolutely no history of cancer in their family, and they are the ones that unfortunately get that.
It's just sometimes it's just random, right?
It's random, yes.
Right. Well, we're up against a break. If you have a question for Susan Rick, give us a call. She's the Director of Cancer Services at Community Medical Center. She has a bachelor's in nursing, a master of public administration, been a nurse for 32 years, 15 of those years here at the Community Medical Center. We have 5 lines, right?
Yeah, we got a secret 5th line.
So we have a whole bunch of telephone lines open. The number is 721-1290, and we would love to hear from you. And Susan would love to hear your questions or comments, and we'll be right back.
Hello, this is Steve Daugherty with the Daugherty Law Office, bringing you Missoula's estate planning tip of the
All right, lines are open, 721-1290, if you'd like to visit with Susan Rick, the Director of Cancer Services at Community Medical Center. Go ahead, John.
So, one of my questions was about the nature of Montana being kind of a rural state with decentralized population groups and how that affects cancer discovery and treatment.
I think the discovery piece of it, we are really encouraging people to have early diagnosis. And if you have an early diagnosis, stage 1 or even stage 2, your chance of being cured from that cancer is almost 100%. And so there are lots of different things. And I know that you probably know about mammograms, having those done yearly for women. And then also there are lung screening programs now, especially with that smoking risk, that if you've had a smoking history of 30-pack years, which means that you have smoked 2 packs a day for 15 years, multiply those two, that gives you a 30-pack year history, and that you have quit less than 15 years ago, you have an increased risk of lung cancer. And so what we do at Community Medical Center, and we partner obviously with advanced imaging, there's a low-dose CT that is done to screen for cancer. And what it picks up is a small nodule that may or may not be cancer, and then that's put under surveillance, and they monitor that every year. So we're picking up early cancers, which is super important for that early diagnostic piece.
Since we're on the issue of smoking, a lot of my friends that smoked, they've shifted over to using e-cigarettes or other devices. Are there links with that in cancer? Is that a cure-all or?
They don't really know the long-term effects of e-cigarettes. The unfortunate thing is that it contains nicotine, and nicotine is just as addictive in an e-cigarette that it is through a typical cigarette. And so they are really discouraging that, because especially people that think it's not a harm, that nicotine can be addictive, and just like other drugs, it can lead to actually smoking cigarettes. So they really frown against using the e-cigarettes and thinking that you're going to be protected by that.
So let's see if I get this right. So let's say people who don't want to smoke, so they just use a vape. vape, what they call it, vaping, right?
Right.
So that could actually lead them to, because they don't get enough of a buzz from vaping, they go actually to real cigarettes?
Well, and I was going to say that you don't get a big enough buzz from that because I've never smoked one.
I was going to say, I think we're all talking about something we don't really know about.
So anyway.
But the risk of going on to smoking cigarettes then at some point in time in their life because of the nicotine addiction.
Okay.
And I think that you probably also know that nicotine is very harmful for your cardiovascular system. So it causes those vessels to narrow, and it's another hazard in itself.
So what's the most, I don't know, it's hard to say this, what's the most dangerous type of cancer, or is there one that just seems to be the hardest nut to crack, so to speak?
You know, I don't think that I could answer that question for you. I'd welcome you to call and speak with one of our oncologists,
Sure,
or our radiation oncologists, and they could answer that. I don't think that I'm the expert that could answer that question for you.
Okay, but I know that you just built a beautiful new cancer center on the campus there. So tell us what that's all about.
You know, when we started designing that, we started in a very small building, and we quickly outgrew that. And so all of the staff and the physicians and the patients actually had input into the design of the cancer center. And we wanted to be some place that was healing, both spiritually, emotionally, and medically. And so it's designed with that in mind. It's very beautiful. You walk in the front doors, and you feel like you're in a beautiful hotel almost, and you're greeted by the most amazing two people at a front desk that you can ever imagine.
That's nice. My wife and I recently visited a jail in Washington, and we were struck. She's a nurse. She's like, aren't you kind of surprised how similar the jail looks to the hospital?
Wow.
I mean, everything's laid out, so you can walk around the corners, and you got this real sense of like, wow, these are really made for a certain type of purpose, but it's not necessarily the way that any individual would make their own space to live in,
If you ever walked in the front doors of the cancer center, you might want your house to look like that because it's got an amazing fireplace. Not that your house should look like the jail. But it's got an amusing.
I don't think the jail has a fireplace, John.
Well, no, that was my point. Was that the cancer center? Or it sounds like you're trying to get away from that kind of sterile. Well, you want to be sterile, but you don't want to kind of have that like black and white monochromatic look with everything sharp lines and distant.
Exactly. And so it's a very healing environment. The other pieces of that is that we made sure that we were taking care of our patients, not only medically, but then also through the other areas. We have a specialist with the finances. We do a lot of work trying to find funding for people that are underinsured or uninsured from the pharmaceutical companies, either getting drug reimbursements so that they don't have a cost to them or at a less cost. We have a social worker that's oncology certified. She does amazing work with our patients, and she partners with Dr. Julia Bell, who is a psychiatrist on campus, to provide that aspect. We've got a dietitian that is oncology certified. She does a lot of work with our patients that have head and neck cancers, and then 2 nurse navigators that really are the liaison for those patients that are coming through. They are their point of contact from the time that they come in until the time that they're finished and through survivorship.
We hear a lot about all the changes in healthcare when it comes to obviously technology, but on the other end of how we pay for healthcare, right? The ADA and insurances and changes like that. And I guess my question for you is, have things changed that much in the last 6 years for cancer coverage? I mean, this is a type of health problem that can be very persistent, could take years, huge expenses sometimes.
I would say that, and it's unfortunate because people do go through financial strain and oftentimes leads to lots of nightmares. But the cancer, the way that we have seen it in the last year, the pre-authorization is getting more and more needed for absolutely everything that we do for patients. A year ago, we didn't have to pre-authorize different medications, and the insurance companies have changed over this last year, and my insurance person is calling and getting pre-authorization for all the different drugs that we're using besides radiation, which is obviously one that you would want to pre-authorize to make sure that people are being covered.
Can you tell us what that means, pre-authorization?
Pre-authorization is when you call the insurance company and you tell them what the patient's diagnosis is and where they're at, and then you give the pharmacy has J codes, that's what they call them, and the J codes are indicative of what type of medication they're on. We talk about different regimens and cycles with chemotherapy, and we make sure that all of those drugs are then covered by the insurance company, so there's no surprises.
What happens when someone comes in who is not insured or not fully insured, and they don't get that authorization, and yet they still need to be treated?
We try very hard to get people insurance, and the changes with the Obamacare has been it's been a great thing for our patients in cancer. We also have a charity program at the hospital for people that are uninsured, and we also try very hard to get people on Medicaid if they are eligible for that, or Social Security disability.
Yeah, we have a Facebook comment, then we have to take a break.
Sure. Katie says, there are several cutting-edge technologies and drugs that are showing promise for beating cancer. Does Community Hospital have access to some of these new procedures and drugs that are in research and testing stages?
We do have research at Community Medical Center. We have all of our trials through the Montana Cancer Consortium, and there are hundreds of trials that are available to patients. We also have patients that are going to other cancer centers that may be in phase 1 or phase 2 trials that are not out on the market yet for other hospitals to participate in. So we refer those patients out for that. We also have lots of facilities in Missoula and at Community Medical Center. We've got robotic surgery, we've got radiation. We do high-dose radiation for breast and for prostate. So there's lots of modalities here in Missoula, but we also refer our patients out and have great relationships with those referral centers.
Okay, we're going to come right back. And Mark, we're going to get your phone call on right after this quick break. Stay with us. This is Health Talk, and we'll be right back.
Am I doing okay?
And we are back on Health Talk. 721-1290 is our number. Okay, you got your headphones on, Susan? Here we go. Well, let's get and I believe this is Mark. Good morning, Mark. Thank you for holding. You're on with Susan Rick. Go ahead.
Morning, Susan. I got a question. There's a couple in the European Union, there's a couple countries over there where their health insurers put a lifetime caps because they want their people to make sure they live more healthier. So they have like a lifetime cap, like $500,000. After that, they got to find money for their medical costs from friends, relatives, churches. You think the U.S. insurance companies are going that way?
Actually, it's
Thanks,
interesting.
Mark. Go ahead.
It's interesting that you would say that, because one of the things that they are, with the changes with MACRA, that they are looking that to see that there is a lump sum of money that you're given for a certain diagnosis to the hospital, and then the hospital has that money to use to provide your care. And so the whole part of that is to say that we can do this for an X number of dollars and that you can spend that money very wisely. I don't know of anything that has a cap on it, except for that some insurance companies do have a cap on their insurance for certain programs.
Well, what is MACRA?
MACRA is a Medicaid and Medicare change with the way that they are doing their insurance.
Oh, so this affects a lot of your clients.
Yes, it will.
Wow. Interesting. Now, when did that change come about? Oh, okay.
Okay.
Fairly recent.
All right. Let's talk about the Cancer Center in general. You have a number of programs that you offer here. It's called Med1, Rad1, and Montana Breast Health. Could you kind of go through those?
It's actually medical oncology. That's MedOnc and RadOnc. That's kind of the short term for that. Medical oncology, we provide all the services that you typically think of chemotherapy.
Sounds like Pokemon monsters.
Yeah, totally. I caught a MedOnc.
And radiation oncology, we partnered with the Billings Clinic, and we have a radiation oncologist. We do the high-dose radiation and our external beam radiation. We also have Montana Breast Health, which is now moving over to the Cancer Center. They'll be moving in September. And then we also are going to start a lung nodule clinic and then further expand that low-dose CT.
So that lung nodule clinic, that's kind of directly dealing with smoking-related cancers, right?
It could be. What happens is that oftentimes there are CTs or CAT scans that are done for patients for another reason, and the radiologist will pick up on an incidental finding of a lung nodule. And so in the past, those may or may not have even come up on a referring physician's radar. And so what we'll be doing is following those incidental findings to make sure that those are not early cancers.
Now, we only have about a minute left in the program. So how do we get in touch with your office and your clinic and get set up on being treated?
We're on the Community Medical Center campus, and I like to think of us as the 911 for cancer, and our telephone number is 327-3911.
Well, I like that. 3911. Very, very good. Now, how many folks are on your staff there? Do you know?
21. We have 21 people.
Okay. And so, are you fairly busy all day long, or hopefully you don't want to be that busy? You want to be maybe not quite so busy. I don't know.
You know, we like to be busy because obviously days go along a lot faster. We are our peak times are during the mid week, Tuesday, Wednesdays, and Thursdays. But we have lots of ample space for our patients and their families. And we don't want to be busy. It would be great if we could find a cure for this. But in the meantime, we provide great services for those patients that do have cancer.
Give us that number one more time.
327-3911.
Susan, Rick, you were awesome.
Thank you.
Thanks for being on the show. And thank you, Robin. Appreciate that. And that's going to do it for Health Talk today. We thank you all for joining us this morning. And we're going to have Talk Back here coming up at the top of the hour. We'll have, I believe, open phones. And so whatever's on your mind, we'd love to hear from you. It's 721-1290. We will be back after the top of the hour.